Suboxone and Depression. Opioid use disorder is a long-term condition that is often accompanied by depression. Suboxone is a medication commonly used to treat opioid use disorder. But does it also treat depression? In this video, we'll discuss Suboxone and its potential impact on depression. Opioid use disorder is a severe condition that can require complex treatments. Unfortunately, it is often linked to depression, creating a challenging combination to manage. Studies have shown that opioid users are at a higher risk of developing depression due to the chronic nature of their dependence. At the same time, those suffering from depression may be at an increased risk of misusing opioids. Suboxone is a medication that contains buprenorphine and naloxone. Buprenorphine is an opioid partial agonist, while naloxone is an opioid antagonist. The combination of these drugs makes Suboxone effective at treating opioid use disorder and other conditions associated with opioid use. Suboxone binds to the same brain receptors as opioids, but with a milder effect, reducing cravings and withdrawal symptoms. It allows individuals to experience the same effects without becoming completely dependent on the drug because of its much lower potency than opioids. The FDA has not approved Suboxone as a treatment for depression. However, some medical professionals believe that Suboxone could potentially be used to treat depression associated with opioid use disorder. That is because Suboxone works in the same part of the brain where serotonin is released, and increasing serotonin levels can reduce symptoms of depression. Additionally, Suboxone's ability to reduce cravings and withdrawal symptoms can give individuals more control over their lives and improve their overall well-being. While Suboxone does not usually cause depression, one may feel emotional changes when taking the medication, such as irritability or decreased energy. These are simply some of the behavioral and mental health side effects of taking Suboxone and not symptoms of depression. It is possible to experience depression during Suboxone treatment. OUD is a chronic disorder. Once you stop using opioids, you will experience withdrawal effects which can lead to feeling depressed. Others may still experience cravings for opioids during Suboxone treatment, which can lead to depression due to not being able to use their preferred substance. If signs of depression are present during Suboxone treatment, immediately consult your doctor. Medication-assisted treatment, or MAT, combines Suboxone with counseling and behavioral therapies to provide individuals with the best chance of recovery. Suboxone helps reduce cravings and withdrawal symptoms associated with OUD, while counseling provides individuals with strategies for coping with addiction and depression. However, it should not be considered a substitute for therapy or counseling. It is simply one part of a comprehensive treatment plan for those seeking recovery from OUD and depression. If you're struggling with opioid use disorder and depression, you must speak to a Suboxone doctor immediately. Visit Suboxonedoctor.com and find a Suboxone doctor today and take the first step towards a happier and healthier life.